The Class Act is a national voluntary long-term care insurance program. The idea is that today very few people put aside the money they need or buy insurance to care for themselves in frail old age. If you have a stroke, if you have dementia, very expensive. Nursing homes cost on average $75,000 a year. Home health aides are $20 an hour. People are not prepared. Very few people buy private long-term care insurance. Fewer than 10% of people in their 60s or older have this insurance. Most people rely on Medicaid, which is a means-tested, welfare-based program for people who are very poor and very sick. Medicaid long-term care is a safety net, but it's not a very good one. It's not what you want to rely on. And the financial pressures on state and local governments and the federal government are tremendous under Medicaid. So the thought was, why don't we create an insurance-based program that will be available to everybody? There'll be no underwriting, so you could get the insurance whether you're sick or not. And it would provide an opportunity for you to insure yourself against this risk. The Class Act is designed so that people who are already working, who are currently working, but who have a disability, can purchase this insurance. It's great for them. I think it's a terrific idea, in fact, to decouple working people with disabilities from the Medicaid program. That's a terrific idea. The trouble is, you're left with a situation where so many people in that situation are buying the insurance. Healthy people who are looking to hedge their risk against needing long-term care in their old age won't buy it because the premiums will be too expensive. The question is, what can you do about it? There's a couple of choices. The big reform you can make is you can make this mandatory. That's what nearly every other developed country in the world has done, with the exception of the United States and the United Kingdom. Almost all the rest of Europe, much of developed countries in Asia, have gone this route. They've made it a mandatory program, much like Medicare is in the United States. It works quite well. It's usually paid for with a payroll tax or with a combination of taxes and premiums. People seem very satisfied with it. It resolves a lot of the problems. We don't seem willing to do that in the United States. We just went through a debate over, in the health reform law, over whether we even wanted a public option, and the public didn't support that. It's unlikely they would support the next step, which is actually a mandatory program. If you don't make it a mandate, then what do? Well, you can tighten up the underwriting requirements. You can make it harder for people who already have disabilities to buy the insurance. That will drive down the premiums. It'll be a good thing for people who want to buy to hedge against the risk of needing care in old age, but it creates a problem for people who are working who have disabilities. Navigating that is going to be a huge challenge. The politics is very difficult. One of the reasons the Class Act passed, it was part of the health reform law, was because the disability community and the aging communities were able to get together and support this. If you reform the program so you make it more difficult for people with disabilities, you're going to lose the support of those groups. If you don't make those reforms, you're not going to have people buying. So how do you do that? How do you balance that? It's a huge challenge. The people in the government who are looking to implement this law, people at the Department of Health and Human Services who are designing the policies, don't think that more than about 10% of working age people will participate in this insurance. If they're right, if they can't get the participation rate higher than that 10%, they need to get it into the 20s or maybe 25%, the fear is that the premiums are going to be quite high. The higher the premiums, the fewer people participate. One of the keys here is, where do you set that initial premium? As you said, the Secretary of HHS has until 2012 to actually design the policy. Key question for the Secretary is going to be, where does she set that premium? If she makes it too high, people won't participate. If she makes it too low, they're going to have to raise the premiums once people are involved in it. That's what's happened with private insurance, and it's created a real backlash from consumers. You don't want to buy an insurance policy and then 2 years later find out the premiums went up 45%, which is what's happened with private insurance in recent years. This is what they call vesting, and the idea is that you would have to pay into it for a period of time before you get benefits, and that's a way, almost a substitute for underwriting. Since you're going to let people enroll if they're already working, you don't want people to enroll in this insurance pay 1 month's worth of premiums and then immediately begin to collect benefits. So the idea is you'd have to require people to to pay the premiums for a period of years before they can get benefits. That may reduce the number of people who are already disabled from participating. And again, that's something that they do to try to keep the premiums relatively low. One of the other issues about that 5-year vesting period is a budget issue. Because the government will be collecting premiums for the first 5 years but not paying any claims, it makes it look like the Class Act is a big revenue generator for the purposes of the federal budget. In fact, it generates, by the Congressional Budget Office estimate, over $70 billion in revenues without having to pay anything out in the first 5 years. That in turn has generated a huge controversy among Democrats and Republicans about whether or not these class premiums are being used to make it look like health reform costs less money than it really does. Class Act is going to be available to people starting at age 18. Most people don't need long-term care until they're in their 80s. So you're asking people to begin to pay premiums now, to reduce their current consumption, agree to have less money in their pockets, to go to Starbucks, or begin to save for the kids' education, whatever it might be, or begin to save to buy a house, asking them to reduce that money so that they can protect themselves against the risk they don't want to think about that they're likely to not have for 60 years. That's a very, very difficult marketing campaign. The government is working on this, and interestingly enough, a lot of private advocacy groups and some nonprofits have promised to kick in money to help build a new marketing campaign to encourage people to do this. One way you can market it is you can show people what the risks are. 70% of us will need some long-term care before we die after age 65. It says nothing about people who may need long-term care because of illness or accident when they're younger. But even among people who are over 65, 70% will need some care. We would need to put away on average $50,000 to pay for our long-term care needs in retirement. We're not prepared for that. To the degree that the government can encourage people to do it, to begin to put money away, to begin to prepare for a need that it's maybe not inevitable, but there's a high likelihood you're going to require this assistance, that's a very good thing, but it's a tough sell. We Americans are very bad savers in the best of circumstances. We don't save for retirement even when we think retirement is golf and cruises. Will we save for frailty and old age? That's a tough marketing campaign.